topic of joints and bone health. Bones and joints. How flexible are your joints? How strong are your bones? Okay, so we want to make sure that we do everything to strengthen our bones and our joints. Okay. All right. So I'm going to go by the American data because that's what we have here. By the year 2020, most Americans, about half Americans who are older, 50 years or older, always get bone fractures. And where does this bone fracture come from? Okay? We see it. It's a very common thing, and especially even more on women. So we want to find out why a lot of people are having bone fractures. These bone fractures are very deadly. For one, they can put you in bed for months where you are unable to get up because they happen not on the small bones, but they happen on the big bones that support the body, that help you stand up. Okay, you will hear about hip fractures from a lot of people, or you hear about a whole lot of back problems. So we want to talk today and see why this is happening or why it has become so common among women, especially women. And mostly it happens too often, not that it doesn't happen on Black women, but in America, it's more common in white women. All right. So we need to know how to build bones that are strong, solid, and dense. That allows us to have a good activity, physical active life without having any problems. Okay, without our bones getting porous or brittle. And let's look at what really turns bones brittle and what is osteoporosis. So the bone on the left is really nice and thick, but you can tell from the bone on the right that is beginning to have small bones, small dents, small little holes everywhere. Okay, so this is where osteoporosis begins. So osteoporosis is a reduction of bone mass. So your bone mass begins to decrease, but you can't tell unless you get these bone scans or checks to see what is going on. It's the most common bone disease. And it's the one that causes all these fractures. And they continue increasing daily. So we don't want any of these holes in our bones, and we want to see how to prevent it. Okay. So this happens, the bone loss starts increasing as people get older. And this is just showing here. This slide is just showing how the bones begin to decline, especially after the age of 50, when women start hitting menopause, and even as the men as we get older. So you see the bone density starting to go down and starting to decline. Okay. All right. The data here shows that a lot of people in 2002, 43.7 million had already started having osteoporosis. And as the years go, the numbers increase. And it's still being projected that it will be more than this. Okay? And we see a lot of people in hospitals. Sorry about that. We see a lot of people being hospitalized because of bone fractures where they fell, they have to go back in the hospital. We see TV commercials of people advertising for products that would build their bones. This is the problem right here. We want to try as much as we can to prevent this. And how do we go about that? What can we do to prevent this? One of the things that we need to do continuously is exercise. Be more aware, health awareness. What is a health awareness? If you're drinking a lot of beers and smoking, you want to look into that and see what you can do, because those are harmful ways. Okay, so you're not being health conscious when you're drinking and smoking. They're major causes of many health issues. So a healthy diet is another plus. So we want to include continuously healthy meals. All right. So the key nutrients that are involved in bone health. The first one is calcium, which is very, very critical for development and maintenance of bones and teeth. Development from when a child is young, we start giving them milk because there's calcium in milk. There's calcium, phosphorus, magnesium, and vitamin D in milk. So that's why you see kids getting it. So you want to make sure that they have all these three nutrients, including vitamin D, which helps promote absorption of the calcium or the phosphorus, the things that help build the bones. So to prevent our kids from having rickets, we all know about those, the legs that are bow-legged. To prevent that, you want to make sure that the kids, by the way, that is called osteomalacia, when the kids start having rickets. And in adults, it's another cause for osteoporosis, when the bones are not strong enough. So calcium is a very, very powerful nutrient. It is useful for even neuromuscular functions, so muscle functions. You can see that's why we have the little heart sign on here, because it's involved in also cardiovascular function, muscle contractions. And the most important muscle, of course, is our heart, relaxing and contracting. Nerve, messages go through the nerves all the time. You touch something hot, get a message from your hands, this is too hot. The nerves. Again, calcium is involved in that as well. And the older we get, the harder it is for us to absorb these nutrients. And that's where the supplements come in. So you add to it to give it a boost. So the other item that is also needed for bone health, this time we're talking about bones. We're going to talk about joints in a minute. So magnesium is very, very good for heart health. And you hear people or doctors or anybody saying, oh, I take a banana a day, to increase potassium and magnesium in my body. So it promotes normal blood pressure. Okay. Magnesium and potassium are very powerful for improving your blood pressure. They are in many vegetables. So that's why, again, it's good for your diet to be high in vegetables, because they're essential for healthy muscles and nerve functions, and they support energy metabolism. So again, metabolism is good when you're trying not to gain weight. You're trying to lose weight. Build your metabolism up. Eat those veggies. And of course, this magnesium is also essential for very many biochemical reactions in our bodies. The third one, vitamin D. And we have it here as D3. You might see it also as D2. But all of them end up being useful in the body as vitamin D. So low levels of vitamin D are linked to heart disease, autoimmune diseases, cancer, depression, osteoporosis. So today we're talking about osteoporosis, but we have to mention all the other ones. So prevention of cancer is very important. And we can do that by also taking vitamin D as a supplement or eating foods high in vitamin D. So if you're not getting enough milk or you're not getting vitamin D from eggs or liver, then you add a vitamin D supplement to make sure you're also getting that. The reason why we have the sun as one of the things posted here is that vitamin D, the sun converts our vitamin D naturally. If you stay in the sun for a few minutes, the energy that comes from the sun activates chemicals or biochemicals under the skin, including cholesterol, and is turned into a form of vitamin D that can be used in the liver to make the real vitamin D that we need to use in our bodies. So it's always good to go out in the sun. Now here in the US, very, very common for a lot of African American people, because we are darker skinned and then we're staying indoors for a whole 3 to 4 months because it's freezing. Nobody wants to take, to wear open clothes or stay outside. We run to the car, run to the office. So you don't get sunlight. And that brings your vitamin D. You see a lot of Black people have low vitamin D for that reason. So again, that's another cause of bone problems because vitamin D helps absorb the calcium and the phosphorus. So again, vitamin D is also important for the neuromuscular and immune functions. Okay? And of course, immunity also goes with cancer prevention. So D3, vitamin D3 is 3 times more effective than D2 in the body. But all of them, whether you take D2 or D3, will become vitamin D that is useful to the body. And you will see that most products, like eggs or milk, they have D3. Okay. Of the skin, when it transforms, the sun transforms the cholesterol into D, it is D3. So both of them are very good. There's nothing wrong with taking D2 as well. Okay. So again, it says 5 to 30 minutes in the sun to expose your arms, your legs, the back of your legs, without the sunscreen. We don't wear Black people don't use a lot of sunscreen. But anyway, the point is to increase vitamin D. Okay, another good product that has everything included is the calcium and magnesium combined together. And this from Neolife comes with 3 things in it: calcium, magnesium, and vitamin D. It has 1,000 IUs of D3. You can't beat that. It's a very, very good product, powerful for prevention of osteoporosis. Again, the product that you get from Neolife is pharmaceutically pure. Okay? It doesn't have any additions to it. It's just pure product. And it has a 2-to-1 calcium to magnesium ratio, which means it's going to be easier for you, the body, the way it's needed in the body, to be utilized in the body. 1,000 IUs of vitamin D3 is very, very good for a product to take every day. Okay, chelated. And the word chelated means the way these products are made, they are combined in a way that is easier for the body to absorb and become useful. And that is what is called double amino acid chelation. It's the combination of it. Perfect. Good for you. Okay. So again, we give Neolife this, credit for doing so much work to make sure that the products that we get are less irritating to the stomach when you take them, and they disintegrate very quickly and get absorbed very quickly. That's why people give their stories or testimonies within a few weeks of taking these products. So we want to maintain good bones and joints. So again, joint problems. So we're going to start the part on joints, right? And this is where we hear people say they have arthritis. Osteoarthritis is the bones that affect the joints. This is a healthy joint right here. And this is a joint that have been affected by osteoarthritis. You can see how the white part, which is the cartilage, has thinned out and either have little fragments on the bottom. Painful, very painful joints. Okay, so what do we need to build this flexible, healthy joints? Improve your range of motion. We need a couple of things. We need zinc. We need boron, silica, glucosamine, and omega-3 fatty acids. Okay, so zinc stimulates bone growth. And zinc is being used a lot this year because of COVID. So we need that for many things. Okay. And we're going to talk about other products as well. Okay. So taking glucosamine helps slow the breakdown of the cartilage that we just saw in the photo, which looks very painful. It also helps build and repair. and regenerate new cartilage. That is a big one right there, which reverses osteoporosis. Okay, it reduces the pain, because if you have joint problems, you're definitely going to be in pain, and it gives you comfort, flexibility, mobility, and it's very easily absorbed. So we have that product in here with Neolife. It's called Full Motion. Full Motion comes with all those nutrients that I mentioned above: silica, glucosamine, all that, and zinc. It's included in this. Okay, it's pharmaceutically pure. So if you know somebody who is having joint problems, suffering from pain, please let them know about these products. Okay, it contains this herbal complex made with herbs like bromelain, okay, which is in the pineapples, white willow, boswellia. Okay, and this here regenerative mineral complex is the one that has the zinc and the boron and silica, only available from Neolife. So it disintegrates very quickly to help you get your joints back to normal. All right. Omega oils, omega oil or salmon omega plus is another product that can be very, very good for joints. It lowers inflammation, okay? And the omega oils from Neolife always have they're very potent. They have all 8 omega oils. Okay, so there's 8 of them right down here. In other words, when you eat fish, like when you eat something like salmon, you're getting all 8 omega oils. But sometimes when you buy the omega oils from a store, they might only have the first 3. But Neolife includes all of them, which works better for us. It's clinically proven and guaranteed to work. Okay, and it's equivalent to eating salmon dinner. Okay, so the benefits of this is flexible joints, balance, it lowers inflammation, which is also good for other things, prevent, including cancer. Lowering inflammation in the body is very important. And that's how it looks. Healthy heart, brain function, improves joints, it improves eye health, and even for pregnant women when they take it, it improves the fetal eye and brain development. And no contaminants, been tested for that. Okay, so chewable calcium complex is the other item from Neolife in the form of NeoCal. Chewable, creamy, mint flavored. Okay, so all these products that we can use to help people who have joint problems build their joints back to normal and start doing some mountain climbing or just walking regular. So we have many, many products in Neolife, not just the ones I mentioned. We have other things like carotenoids, we have threonine, we have so many good products. Neolife shakes, which helps bring your weight down so that you don't have to wear your joints up. So all those are products that are available in Neolife. And I would encourage everyone who is here today to join into this mission. Just jump in and join us with our mission of bringing the world to a place where we are healthier, happier